I'm going to show you some modifications that I've done to my tubing. I don't have my primary set, so I've adapted my secondary set for right now for the IV push. Here's my secondary tubing. We are going to use this as the sheet or the towel as the patient's arm, as the port is taped and there is no tubing that flows off of that. So primary tubing, patient would have tubing connected here, and it would be connected to the patient's arm. It would actually be backwards. So that is that. I'm going to hook this back up and we'll get going. Okay, so first thing we're going to do, walk in the room, wash my hands, introduce myself to the patient, verify patient's name and date of birth. We're going to see what the doctor has ordered, and the doctor has ordered Zofran for this patient, and he will be receiving it over at least 30 seconds. Ideally, you want to push it for 2 to 5 minutes. So we're going to check our orders here. They're all verified. We're going to tell the patient what he's getting the Zofran for, and he is getting the Zofran for nausea and vomiting in hopes that that will settle that down. So I'm going to wash my hands again since I've touched things, put gloves on, maintain a strict aseptic technique, do our best in this video. Going to prepare my medication now. So we're going to withdraw 2 milliliters of air in our syringe. I'm going to place the cap where it's easily, I'm going to scoop our cap back up real quick. Grab our alcohol pad, pop our top from our medication, scrub the top and all around it for 30 seconds at least, nice and clean. Right, then we have our 2 milliliters of air in our syringe. We are going to inject that. So then we are able to withdraw our medication. There we go, 2 milliliters. We're going to scoop our cap back up. Make sure it's nice and secure. If for whatever reason we walk away from that medication, we can label it, and it should be fine. Put the dose, medication name, dose, and amount that we have in the syringe prepared. So next we're going to take a new alcohol swab, clean off our port closest to the patient. Ask the patient if they've had any pain or swelling with their IV site lately. They say no, so we're going to go ahead and check the patency of it and give it 2 milliliter normal saline flush. So first we're going to pull back. There is blood withdrawing. So now we can push 2 milliliters normal saline. Be sure that the IV is nice and patent, which it is. We're going to take our flush off. We're going to remove the needle. There we go. And then we're going to attach. We're going to push this for at least 30 seconds, ideally 2 to 5 minutes. And before I push this, I would have checked to be sure that it was compatible with the solution that's running in the IV currently, and it is. Normal saline is compatible with Zofran. I would ask the patient if they're having any pain, numbness, swelling, like a burning feeling. What? I would talk to the patient. The doctor just came in. Hi, doctor. Do you have any news for us today? No. Alright, we're just about done. Alright, so our Zofran is pushed. So now we're going to go ahead and flush it with another 2 milliliters of normal saline. So push.
What is that?
There we go. We're going to go ahead and document. Back up for a second. We're going to document date, time, what was given, amount of medication that was given, the site, what the site looked like, and what we flushed the IV, the tubing and the IV site with. So we would flush it with, I flushed it with 2 milliliters normal saline before and after giving 2 milliliters of Zofran IV push. Wash my hands, clean up, and